The Pyxis machine is a centralized medication administration machine that is computerized for each patient's individual medication. When a nurse is dispensing or administering medication during the process, if they're interrupted, it will delay the patient's medication to them, as well as we have a process called the 7 rights of medication administration. And if we're interrupted at any point during that process, it can lead to medication errors.
We noticed that the medication rooms were high traffic areas, and during medication dispensing and preparation, there appeared to be a lot of interruptions during that time. And so our project looked at how could we minimize those interruptions. When we did direct observations, we noticed that nurses were interrupted 33% of the time, and they were interrupting each other. The solution to this problem was that we wanted to implement a no interruption zone. So we involved the staff in safety huddles of how we could implement a no interruption zone during medication dispensing and preparation.
Post-intervention, with the signage of a no interruption zone, we observed 16% of the nurses being interrupted. The nursing staff were quite shocked and unaware of their sort of socialization at the Pyxis machine, so it was extremely well received.
The savings our project achieved would be in terms of time efficiency for nurses, up to 15 to 20 minutes less during no interruptions. And so patients would receive their medications in a more timely, efficient manner, and also with the potential to really decrease potential medication errors. One thing I've learned from lean training, it really provides simple but very effective tools, especially for frontline staff, to make effective changes. The changes can be simple changes, but very effective to increase work productivity, increase patient safety, increase employee satisfaction. And a lot of times it's very simple changes that they really want to be involved in brainstorming and implementing.
When you put emphasis on the patient's right to safe healthcare by following a standardized process for safety, that puts patients first. I think as an organization, we're sending a message to the public at large that we are striving to be an efficient organization, and I think that would serve well for the public to know that.